Hi, my name is Raja Flores. I am the chairman of thoracic surgery at the Icahn School of Medicine at Mount Sinai in New York City. So, what is the STS rating? STS stands for the Society of Thoracic Surgeons, and they give a rating on 1 star, 2 stars, and 3 stars. 1 star being the lowest, and 3 stars being the best. And the star rating is based on morbidity and mortality. That means if a patient lives or dies, and if a patient has a complication afterwards that can hurt their quality of life. So, 3 star programs have the lowest death rate and the lowest complication rate. 1 star programs will have the highest death rate and the highest complication rate. And most programs are around the 2 star area, which is actually very good. So when they make that rating, the 3 star rating is the most coveted. That's the one that says that you are heads and shoulders above the rest. And fortunately, for this evaluation, Mount Sinai and our program in thoracic surgery has been rated a 3 star program, which is one of 13 in the entire United States and actually the only one in the tri-state area. So how are the ratings determined? There are many institutions in the United States that submit their data to a central processing area that is located in the Society of Thoracic Surgery database. And so all the surgeons submit to this central database. And so then they evaluate based on your outcomes, on your morbidity, which is the number of complications, the severity of the complications, and the death rate, the number of patients who die after having this procedure done. And it is based on statistics where the majority of people are in the middle, but then you have the outliers that are 1 stars, which can use improvement. And that's the main focus of this. It's not to say who's the best, but where are there areas that you can improve upon? And, we so happen to end up in the 3 star category, which says that our outcomes are superb. And it is a blessing. It is a privilege because you never know. You can do a case perfectly and you can still have a complication and you can still have a death. So it's not something that I would want to be so boastful about, but I am pretty proud of our team here. And what is the significance of this rating for physicians and patients? I think it's very important to understand that, especially when it comes to esophagectomy, there are many different surgeons that can do esophagectomy. You can have general surgeons that do it. You can have cardiac surgeons that do it. But the specialty that really has the best outcomes are thoracic surgeons. When you look at the complication rate for esophagectomy, basically, it can be as high as 40%, which is very high. And at our institution, we had a leak rate, which is the worst complication you can get with esophagectomy, of 1.8%, which is as low as you can pretty much get. And the importance is that if you need an esophagectomy as a patient, number one, you want to go to a thoracic surgeon, because when a general surgeon gets into trouble or a cardiac surgeon gets into trouble with an esophagectomy, who do they call? The thoracic surgeon. So you want a thoracic surgeon involved in it right from the beginning so you can get the best possible outcome. And when you look at thoracic surgeons and you're trying to compare them, there's no better area to look at than the STS database, because these are thoracic surgeons critiquing thoracic surgeons. And that's the strongest part, is that we are checking ourselves. The general surgeons don't have a check on this, and the cardiac surgeons don't have a check on this. But thoracic surgeons are checking themselves with this database, and that's why it's so important for your numbers to have either a 2 star or a 3 star rating in that STS database.